Hi, my name is Shannon Rowe. I'm a doctor and athletic training student at Indiana State University, and I will be talking about my practice-based research of an upper extremity prevention program for collegiate softball players. As a clinician working with an upper extremity sport, we know that seeing shoulder injuries are fairly regular, and if we look at previous research, we know that there's a bunch of prevention programs out there, but none that specifically say which is the best or what is definitely able to be used for preventing injuries. So I kind of used all of that previous knowledge and created a upper extremity prevention program that encompasses a little bit of everything what we know is to be beneficial, but nothing that we know for certain. So I combined therapeutic TheraBand exercises or resistance band exercises, as well as functional exercises and proprioceptive exercises. We measured the effectiveness by using a patient-rated outcome of the functional arm scale for throwers, also known as the FAST, as well as a clinician-rated outcome of shoulder range of motion. What we found was with the shoulder range of motion, there was a steady increase of overall total motion. There was an increase in all internal, external, and horizontal adduction in the fall semester. But when they came back from the fall semester over the winter break, they came back and they kind of never actually returned back to those high numbers that when they left for that winter break. This can kind of tell us the importance of using a monitored and supervised program rather than a more laid back home exercise on your own, if you will. This kind of just tells us, again, with previous research, that we do know that there is more effectiveness with a monitored and supervised program compared to a home exercise program. Another mention is that we did not find any change in the FAST score, which is important because when we started measuring in the fall, most of the patients did not actually even have a shoulder injury. So the fact that there was no change, maybe they didn't see a better improvement, but also, again, you have to remember that most of them did not start off with a shoulder injury. So keeping that in mind, as an overall takeaway, it's important for clinicians to make sure we're using previous literature, that knowing that using TheraBand, functional, and proprioceptive exercises are so far okay to use in their clinical practice. Again, remembering to monitor your patients so that way you can have your possible optimal results. Thank you so much.